Why I think exosomes are better than PRP. So I get asked this question a lot. What's the best way to maintain my hair, grow my hair? And so growing your hair and maintaining your hair, and we're talking aside from a hair transplantation here, because that doesn't actually grow your hair or maintain your hair. It actually redistributes your hair. So if you're actually trying to grow your hair, preserve your hair, my favorite treatment are exosomes. Let's define what exosomes are. Exosomes are intracellular messages. They're super small, and they're kind of like little envelopes that are sent from one cell to another cell. And when you deliver these exosomes to your hair follicles, what they tell your hairs are essentially wake up, stay alive, do not become miniaturized, and for those of you who are about to die, we're going to kind of revive you and come back to life. We're going to compare this to PRP. PRP, for those of you who don't know, is called platelet-rich plasma. And the way platelet-rich plasma works is your body, you have to have a blood draw. The blood is spinned. Once the blood is spinned, the platelets are concentrated and injected back into your scalp. And this tells your hairs, hey, come back to life as well, because we're going to have these growth factors that kind of try to revive your hairs. What I find is it's about a 5-to-1 ratio of PRP to exosomes, meaning you need 5 treatments of PRP for 1 treatment of exosomes. Neither one of these is going to revive someone's head with slick baldness. But for those of you who have the beginnings of hair loss, miniaturized hair, what this can do is encourage those hairs to come back. Exosomes, why I like them better than PRP? First of all, it's much less uncomfortable. When we inject our exosomes, there's a little bit of lidocaine in there. And this does 2 things. It kind of keeps the exosomes in place from getting absorbed in the bloodstream, but also makes it much more comfortable. PRP, for those of you who don't know, is very acidic and it can burn. I've had my head injected with PRP multiple times, and it is not for the faint of heart. Second reason I like exosomes better than PRP is it actually is much more effective, in my opinion. The best results I've seen are exosomes. PRP really takes dedication, multiple treatments, multiple blood draws, which most of our patients don't like. The third reason I like exosomes versus PRP, I actually think it's more cost effective. It's slightly more costly than PRP kind of on the upfront, but you're going to need less treatments. And finally, the reason I like exosomes is it doesn't have to be an all or none, meaning you can do parts of an exosome treatment. You can do a full vial, a half vial, a third of a vial, and we have these things called mini-X's, which are great for patients who are coming in who have one area that bothers them. And a lot of our female patients, it's going to be in that classic Christmas tree pattern right by their part. For some men, it's going to be in the crown or the back of the head, top of the head, where they're noticing that hair loss. So you don't have to do the full head. You can do part of the head and save significantly more money.